adrenal incidentaloma. So this would be clinical scenarios where a patient has gone investigation for some other cause and you incidentally note a adrenal tumor. So the questions that are asked you in exam, what would be your approach and management for this patient? So prior to starting that, the most common of them is a non-functioning adenoma. This has been asked multiple times in various examinations. So let's understand what we do in case of adrenal incidentaloma via flowchart. So in such patients, when you find a swelling, the first important step would be to take a history. So what are the important positive history that you need to take in such patient? Prior malignant disease, history of hypertension, and any history of symptoms of glucocorticoids, cortisol, aldosterone excess. Right? Now, once we take this history, we need to establish whether this tumor is a functioning tumor or not. To assess the function tumor or not, we do the following test. Number one, 24-hour urine metanephrine and catecholamine assay. 24-hour urine and metanephrine and catecholamine assay. The next test would be a low dose dexamethasone suppression test. And plasma aldosterone and renin activity. Now, with this, we would try to determine whether it is a functioning adrenal tumor or not. If it is a functioning adrenal tumor and your answer to this is yes, then we go for surgery. What surgery do we go? We go for adrenalectomy, right? Now, if it is not a functioning adrenal tumor, then we consider the tumor size. If the size is more than 5 centimeter, then we go for surgery. If the tumor is less than 3 centimeter of size, then we basically go for observation and follow up with CT or MRI. In case of tumor size, which is in the borderline ratio, that is 3.5 centimeter, what we do is we check for suspicious imaging. We see if it has ill-defined border, there is presence of any hemorrhage, there is any internal calcification, presence of high vascularity, and in case of CT scan, they might be giving you the Houseful unit. If it is more than 10 Houseful unit, it is suggestive of malignancy, and less than 10 Houseful unit is more towards benign. Or if the age is less than 50 years or a young patient, right? Any surgical risk factors, then you have the interval tumor growth. If The answer to any of such question is yes. Then we go for an adrenalectomy, and if the answer to this is no, then we follow up the patient with CT scan or MRI. So, summarizing your incidentaloma, the first important question that is asked is the most common, which is your non functioning adenoma. Then you need to check whether it is a functioning adrenal tumor or not. Then you need to see about the tumor size. For more than 5 tumor size, we go for operation. In case of less than 3 centimeter, we go for an observation, and in the gray zone area, that is 3 to 5 centimeter, we check for the suspicious imaging, young age, surgical risk factors, and interval tumor growth. If present, we plan for an operation. If not, we basically observe the patient. Thank you.